Welcome to the Deep Dive. We take complex topics, break them down using key sources, and give you what you need to know.
Helping you get informed fast.
Today, we're diving into something really core to mental health nursing, framed by this quote. It takes people to make people sick, and it takes people to make people well again.
That's Harry Stack Sullivan, way back in 1953. Still so relevant.
It really is. It speaks to that fundamental human need for connection, right? Like Siegel talked about, we seem to be, well, hardwired for attachment.
Definitely. We form groups naturally. It's psychological, even physiological. We depend on each other from the get-go.
So a group is basically a set of people connected, interdependent, sharing some kind of purpose.
Yeah, exactly. And that purpose can be anything, really. Think about a marriage that's a social group.
Or like a research team trying to cure cancer, that's more task-focused.
Right. Or engineers building, I don't know, a nuclear reactor. Groups range from just 2 people all the way up to, well, whole nations. It's a huge spectrum.
But today, we're zooming in, right? We're focusing specifically on therapeutic groups.
That's the plan. We're going straight to a key text for you nursing students. Varkarol's Foundations of Psychiatric Mental Health Nursing.
Our mission here is to really unpack the essentials, group dynamics, how they develop, and crucially, your role as a nurse in making these groups spaces for healing.
And this isn't just abstract theory. This stuff is gold for your clinical practice and, super relevant for the NCLEX too.
Okay, so how do we get from just any gathering of people to something specifically therapeutic?
Well, think historically for a second. After the World Wars, there were just vast numbers of traumatized veterans.
Ah, right. That must have highlighted a massive need for collective healing environments.
Precisely. That experience really pushed the development of therapeutic groups. It showed that people could heal together.
So unlike my book club, a therapeutic group has a very clear intentional purpose.
Exactly. It's structured specifically to foster recovery, to promote well-being. The interactions themselves become the tool for healing.
What makes them actually work then? What are the active ingredients, so to speak?
Good question. The source mentions Yalom's therapeutic factors. We can't list them all now, but think about core ideas like, universality.
That feeling of, oh, I'm not the only one going through this.
Yes, that's incredibly powerful. Or instillation of hope. Seeing someone else get better gives you hope for yourself.
So these aren't just buzzwords. As a nurse, you're actually trying to cultivate these factors in the group.
Absolutely. And to do that effectively, you need to understand 2 key concepts: group content and group process.
Okay, let's break those down. Group content sounds like the topic, what's actually being talked about.
Exactly. It's the what? The explicit discussion, the activities, the information shared. If the topic is coping skills for anxiety, the skills themselves are the content.
Simple enough, but then there's group process. That sounds deeper, more complex.
It is. It's the how.
Yeah.
It's all the underlying dynamics, the interactions between the members.
Like how people talk to each other, who talks the most, who holds back.
Yeah. And power dynamics, how emotions are shown or maybe not shown. Communication patterns, nonverbal cues, interruptions, all of that.
Okay, I can see why understanding both is vital for a nurse. You're not just listening to the words.
All right. You're observing the dance, the interactions. If you only focus on content, you miss, well, probably half the picture, especially the stuff that's really driving behavior.
So observing the process lets you intervene more effectively, guide things in a healthier direction.
That's the goal. Spotting unhealthy patterns, helping the group understand its own dynamics, that leads to real insight, seeing the forest and the trees.
All right, so groups have content and process. What about the life cycle of a group? Do they go through stages?
They absolutely do. Think of it like a journey. And each stage requires a slightly different touch from the facilitator, the nurse leader.
Where does the journey start?
It actually starts before the first meeting, in the planning phase.
Ah, the prep work. What does that involve?
It's crucial. The nurse leader decides the group's specific purpose, grief support, skills training, psychoeducation. Then you think about who should be in the group, the right mix.
Okay, and where it will meet, the setting, goals.
Exactly. Choosing a safe, comfortable setting and establishing clear, measurable goals. You're laying the foundation. You don't just throw people together.
Got it. Then comes the first actual meeting, right? The orientation phase.
Yep. Think first day of school vibes. People are often a bit anxious, maybe sizing each other up, testing the waters.
So getting acquainted, figuring out the rules, building trust.
Building trust is key here. Members look to the leader for guidance. They might share more surface-level stuff initially. Your role as the nurse is to create that safety, that predictability, set the ground rules.
Makes sense. Once that trust starts building.
Then you move into the working phase. This is where the rubber meets the road. The real therapeutic work happens.
So people start opening up more, addressing their issues.
Yes. You see more direct feedback, deeper sharing, active problem solving. Members start challenging old patterns, supporting each other, and trying new things. The group's purpose really comes alive here.
And your role as the nurse shifts too, presumably. More facilitating insight, less directing?
Generally, yes. Guiding the process, helping members make connections, fostering that supportive environment where change can happen.
Okay, so planning, orientation, working. What's the final stage?
The termination phase, the ending. And it needs to be planned, not just fizzle out.
Why is a planned ending so important?
Because ending a supportive relationship, even a group one, brings up feelings. Loss, maybe sadness, even anxiety about leaving. This phase allows members to process those feelings.
Oh, and also, look back. Reflect on what they gained.
Definitely. Review achievements, acknowledge growth, both individual and group growth, and importantly, talk about how to take what they've learned outside the group.
So the nurse helps manage that closure process effectively.
Crucial for making sure the progress sticks and members feel empowered moving forward.
Is there anything after termination?
The source mentions post-group issues, mainly evaluation, did the group meet its goals? And sometimes planning for follow-up to support continued growth, sort of bridging back to the real world.
Okay, that maps out the group's journey. But what about the individuals within the group? You mentioned roles earlier.
Right. People don't just exist in a vacuum in a group. They tend to take on different roles, naturally. And these roles really shape the group's dynamics.
How are these roles categorized?
Generally, we think of three types. First, task roles. These are all about getting the job done, achieving the group's goal.
Like the person who always suggests new ideas or asks clarifying questions.
Exactly. The initiator, the information seeker, also the opinion giver, the clarifier, the summarizer, the one who checks if everyone's on board, the consensus tester. All focused on the task.
Okay, task roles. What's the second type?
Maintenance roles. These are focused on keeping the group healthy and cohesive. The social-emotional glue, if you will.
Ah, so creating that supportive atmosphere we talked about.
Precisely. Think of the harmonizer who smooths over disagreements, the gatekeeper who makes sure everyone gets a turn to speak.
The encourager, the
Yeah.
one who offers praise.
Yes. Or the compromiser who helps find middle ground. These roles build morale and safety. They make it feel like a good place to be.
Task roles, maintenance roles. What was the third?
Individual roles, the source just touches on these, but it's basically when someone's personal needs or behaviors kind of interfere with the group's goals or cohesion.
Okay, so maybe less productive for the group as a whole.
Sometimes, yeah.
Okay.
A skilled nurse leader needs to be aware of all these roles, task, maintenance, and individual, and how they're playing out. It's part of your assessment.
Which brings us squarely to the nurse's role as leader. It's clearly way more than just moderating.
Oh, absolutely. You're applying a whole therapeutic framework to create and maintain that safe, productive healing space.
Does that mean there's one right way to lead? One specific style?
Not really. The source mentions different styles like autocratic, where the leader decides everything, democratic, with shared decision-making, and laissez-faire, very hands-off.
But an effective nurse doesn't just pick one and stick with it.
No way.
Yeah.
The key is adaptability. You need to flex your style based on the group's needs and what phase it's in.
So maybe more directive in the orientation phase to establish safety.
Right. And maybe more democratic or facilitative in the working phase to empower members. It's about meeting the group where it is.
And leading groups sounds intense. Is there support for the leader?
There absolutely needs to be. Group leader supervision is critical.
Why supervision?
Well, it's complex work. Supervision helps leaders maintain ethical practice, manage their own reactions like countertransference, when your own stuff gets triggered by the group.
Ah, okay. That makes sense.
And it helps you continuously improve your skills. It's essential for providing good, safe care and for your own professional development.
Speaking of ethics, you've got multiple people sharing personal things. Confidentiality must be huge.
Huge is an understatement. It's paramount. The nurse must clearly establish and rigorously maintain the boundaries of confidentiality. What's said in the group stays in the group. Period.
Because if that trust is broken...
the whole therapeutic process can crumble. It's foundational. Same goes for maintaining clear professional boundaries in general.
Yeah.
Safety and trust first.
Okay, let's shift gears slightly. Let's talk about the real world, clinical practice. You're inevitably going to run into challenging behaviors in groups.
Oh, for sure. It happens. And knowing how to manage these situations therapeutically is a core nerfing skill. This is where your clinical judgment really shines.
So give us an example. What about the member who just talks constantly, the monopolizing member?
Right. They dominate the conversation, maybe interrupt, don't let others get a word in. It throws the whole group off balance.
So as a nurse, what do? You can't just tell them to shut up.
Definitely not.
Yeah.
Your intervention needs to be gentle but firm and always focused on the group's needs. You might think, okay, need to bring others in without shaming this person.
How might that sound?
You could say something like, thanks for sharing all those thoughts. That gives us a lot to think about. Let's pause here and see what reactions others might have. Or you might directly invite someone else. Sarah, you look like you have a thought on this. Or even use nonverbals, like making eye contact with quieter members.
Okay, redirecting, creating space. What about the opposite problem? The demoralizing member, the really negative one.
Yeah. The person who's always critical says, this is pointless, or that won't work. They can really drag the group's energy down.
How do you handle that negativity without getting defensive or shutting them down completely?
You might need to acknowledge the feeling, but not necessarily the validity of the statement. I hear that you're feeling really frustrated right now.
Okay.
But then you pivot back to the group's purpose or process. It sounds like you're feeling discouraged. Let's remember our shared goal here and focus on how we can support each other in moving forward. Sometimes, if it's really persistent and disruptive, you might need a brief separate check-in with that member.
Address it constructively, but keep the group's needs front and center.
Got it.
Hmm.
One more, the silent member?
The quiet one.
Hmm.
They're physically present but rarely contribute verbally. Maybe they look down, seem withdrawn.
The challenge is encouraging participation without putting them on the spot, right? Which could make it worse.
Exactly. You want to invite, not demand. Create safety. You might try an open-ended, low-pressure question.
Like what?
Maybe. I'm wondering what thoughts are coming up for you as you listen to this discussion, or anything you'd like to add, or perhaps a feeling you're noticing. Gentle invitations? Sometimes just making eye contact and smiling can be enough to signal inclusion.
Okay, so managing these behaviors requires awareness, tact, and keeping the group's therapeutic goals in mind.
Absolutely. It's a real skill developed through practice and supervision.
So let's tie this all together for the nursing students listening. We've covered a lot: group dynamics, the stages groups go through, the different roles people play, your vital role as a leader.
All drawn from that core text, Barcarolis. It gives you a solid foundation. And remember, this isn't just stuff for exams. This is bread and butter psychiatric mental health nursing.
Totally. Understanding group work is crucial for effective patient care, especially in mental health settings where groups are so common. And yes, it's definitely NCLEX territory.
You're learning how to use a therapeutic framework, adapt your leadership, handle tricky situations, all to help people heal.
Which is incredibly rewarding work.
So here's a thought to leave you with. Think about these principles: connection, shared purpose, fostering well-being. How might they apply outside a formal therapy group?
Yeah, like in your own life, your study groups, your family, your community groups.
How can you, just as a person, contribute to a sense of shared purpose and well-being in the groups you're part of every day?
It's something to think about. These principles have broad applications.
Absolutely. Mastering these concepts isn't just about building knowledge, you're building empathy, you're building skills that make a real difference.
So thank you for diving in with us today. Keep learning, keep practicing.
You're building something really important here. You've got this.